For my final research paper, I chose to explore the intersection of race and eating disorders. Specifically, I wanted to look into how race and the many social, cultural, and economic implications that come with it play into various racial demographics' experiences with eating disorders. This presentation examines how racial identity impacts the ways in which different racial groups, specifically Black and white communities, experience eating disorders. It will explore the social and cultural factors that contribute to how race affects the likelihood of eating disorder development, as well as diagnosis and treatment of said conditions. Analysis of this manifestation of institutional racism is essential in ensuring that disadvantaged racial groups have equitable access to effective diagnosis and treatment methods to mitigate and prevent unnecessary physical and mental consequences caused by these eating disorders. So in order to approach this loaded topic, I hope to answer the following sociological research question. How does race influence the prevalence, experience, and treatment of eating disorders among different racial groups, particularly within the Black and white communities? And, in response, I formulated the following thesis. Differences in social and cultural values between white and Black communities has led to statistical differences in the prevalence of eating disorders, with anorexia being more prevalent within white communities and Black communities having higher rates of bulimia and binge eating disorder. However, the cultural misconception of eating disorders as a primarily white problem has contributed to the severe underdiagnosis of Black individuals, leading to their underrepresentation in both eating disorder diagnosis as well as treatment. A large part of my argument is that socialization and various societal pressures that differ based on a demographic social location is a significant factor that informs different races' likelihood in developing eating disorders. To illustrate this, let's look at eating disorders from a gendered perspective and how the way that men and women are socialized contributes to variations in the prevalence of eating disorders among said groups. Societally constructed gender roles and expectations have led to eating disorders being a phenomenon that disproportionately affects women. The most basic framework of gender roles is that men must be strong and large, while women are meant to be small and weak. This dynamic has translated itself into a nearly ubiquitous expectation and glorification of thinness for women. While the emphasis placed on such an ideal varies from culture to culture, and even from individual to individual, the nearly universal pressure placed on women to be skinny has had devastating tangible consequences, with over 10,000 American women dying from eating disorder-related complications per year. And while men are most certainly not immune to developing such disorders, statistics demonstrate that there is an undeniable gender disparity, with women being over 5 times as likely to be afflicted than their male counterparts. Due to the societal value placed on thinness, women are a highly vulnerable demographic to the development of eating disorders. Now, before we look further at how racial socialization affects the development of eating disorders, let's look at the prevalence of various eating disorders within Black and white communities. While studies have yet to come up with precise statistics due to inconsistencies and diagnostic biases, general data suggests that Black people are slightly less susceptible to the development of anorexia nervosa than white people. However, when we look at non-restrictive eating disorders, this dynamic tends to switch. Studies indicate that there is a higher prevalence of binge eating disorder among Black individuals than their white counterparts, and are 50% more likely to develop binge eating disorder. As we explored when looking at the impacts of gender norms on eating disorders, societal pressures undoubtedly play a role in one's susceptibility to developing these conditions. Agents of socialization, like the media as well as interpersonal relationships, shape cultural perceptions and values related to body image, which is why cross-cultural differences between African American and white beauty ideals may genuinely contribute to a statistical variation in the prevalence of eating disorders within both communities. Sociological surveys of college-age women, both white and Black, have found fairly consistent differences in the perceived values placed on thinness within both cultures, with white students reporting a higher importance placed on this ideal than Black women in the study. Additionally, there are fairly stark differences between the body ideals embraced by these demographics, In mainstream white culture, the dominant ideal of female beauty has often centered around thinness, with an emphasis on a slim, toned figure as the unwavering standard of femininity and attractiveness. On the other hand, women within African American communities often express a somewhat less rigid perspective on what is considered to be ideal, with fuller body types and curvier figures being valued in a manner not present in white society. These differences are very heavily perpetuated in mainstream Western media as well. In media showcasing white women, thinness is often emphasized and presented as the standard of femininity and attractiveness. In media depicting Black women, women with fuller hips, thighs, and a more voluptuous physique have been seen as attractive and desirable, reflecting this cultural variation in what is considered to be beautiful. Additionally, tensions between Western beauty standards and the phenotypic features of African Americans often fosters a skewed sense of identity and heightens Black people's vulnerability to engaging in disordered eating patterns. For example, colorism and the societal value placed on light skin is linked to unsatisfactory body image and even an increased likelihood of binge eating disorder among Black adolescents. Regardless of these variances in the prevalence of eating disorders between the Black and white communities, it is undeniable that Black people experience and suffer from these illnesses. Even so, there is an undeniable disparity in the access to treatment that each of these parties have access to. In a study interviewing individuals with eating disorders' history of treatment, 58% of non-white participants report having received treatment in comparison to an 80% of white participants. This staggering gap comes from a myriad of factors, from institutional bias to socioeconomic barriers, as well as cultural stigma surrounding mental illness. The first obstacle in the way of Black women with eating disorders receiving proper treatment is the fact that their condition may never receive a proper diagnosis. In clinical settings, healthcare providers are less likely to screen Black patients for eating disorder symptoms due to the cultural framing of the illness as diseases of affluence that affect only wealthy white women. Even if they are screened, however, healthcare providers are often less likely to properly diagnose Black patients with disordered eating due to both the assumption that they are less susceptible to them, as well as due to the fact that the majority of existing literature and studies on eating disorders are based on white people. Therefore, healthcare providers may not recognize symptoms of disordered eating in Black people because their symptoms may manifest in ways that differ from the typical profile seen in mainstream clinical settings. Additionally, they are often not equipped with the relevant knowledge to provide culturally competent care. Additionally, Black people have historically been exploited and abused by the American medical and healthcare system, cultivating generational skepticism and even resentment towards these institutions, causing Black people to decide against seeking help for eating disorders. Economic barriers, such as the cost or time commitment of receiving therapy, also pose significant barriers to receiving treatment. In conclusion, while Black individuals may be less vulnerable to experiencing certain eating disorders, systemic factors such as clinical and societal biases, differences in cultural values of beauty, as well as underrepresentation in research has led Black individuals to be largely overlooked in the conversation of eating disorders, as well as hindered their access to proper, effective methods of treatment. In order to combat this, increased awareness of the ways in which eating disorders manifest themselves across different racial groups, as well as better representation of Black mental health professionals, is crucial in the cultivation of a more inclusive landscape for Black people dealing with eating disorders. As we have seen, race is undoubtedly a significant player in the uniquely intersectional issue of eating disorders, and is one of the largest factors determining the way in which an individual experiences such a grueling illness. Applying a sociological lens to eating disorders and race allows us to understand the ways in which these different identity factors interact, and, subsequently, better recognize how to create viable and accessible solutions.